Good morning, friends. Today, I thought of taking a very interesting topic with all of you, specifically those who are interested in understanding what is stroke and how one can actually understand the basics of stroke, because it is really very important for all of us to understand what is stroke, what are its features, and how you can actually from the basic symptoms can presume that the person is landing into stroke and can take him to the hospital immediately. That is what is the purpose of mine to tell you about stroke. And today I will not go much about the depth of it. I'll just talk about some incidence, prevalence, and what kind of impacts it can overall have. So my today's discussion will be on the first factor, that is why you should care about stroke. What is stroke? Risk factors for stroke. When a stroke occurs, what do you do? And can I prevent a stroke? Where can I learn more? So these are the things which I will be taking. So let me start with the incidence and prevalence of the stroke. Actually, if you see, the cumulative prevalence and incidence of stroke ranges from 500 people across the globe out of 1 lakh people, which means out of 1 lakh people, 500 people are prone to have stroke attack in countries like middle income countries specifically. And let me share with all of you that stroke is the fourth leading cause of death, which means if 10 people are dying because of any medical issue, fourth leading cause of death is stroke. Now, what do you mean by stroke? That I will tell you later on. But 37% of all people cannot accurately identify even one warning sign of stroke. Why I will repeat it, because it is so very important for you to understand what how to recognize a stroke, because a patient who is suffering from stroke needs to be immediately rushed to the hospital. That is so very important for all of us. So let me tell you that 37% of the people, they are not able to identify the symptoms of it, and that is why the patient who has actually had the stroke lands into a lot of complications thereafter. So let me tell you what stroke is. Stroke basically is a brain injury which is caused when a blood vessel to the brain becomes blocked or burst. It actually cuts the blood flow and oxygen to the brain. Let me explain it further. You have your heart is pumping blood to upper part of the body and the lower part of the body. When I talk about upper part of the body, it says that your blood is reaching to the brain. So what happens is, in our arteries, over a period of time, there is a lot of accumulation of fats that in scientific term is called as atherosclerotic plaque. So this lot of accumulation of fat can happen over a period of time, and any time this atherosclerotic plaque can rupture. If this ruptures, it will lead into thrombus, and the thrombus is a kind of clot which can travel all across the body, and probably if it is traveling to the brain, it can actually stick and hit any small blood vessel in the brain, and wherever it will hit, that leads to stroke. Now, my question to you, my understanding and explanation for you to about stroke is that stroke is a kind of a complication which happens in the brain of any individual, and there is a clot which is formed inside the micro vessels in the brain. It could be in the macro vessel as well. So if it is striking to any blood vessel in the brain, the supply of blood to that particular area hampers. Now, what is the function of blood? The function of blood is to provide oxygen and nutrition to the cells of all the body, including the brain cells. Now, what is happening whenever there is a blockage? So because of this blockage, the brain cells are not able to get that sufficient amount of oxygen as well as nutrition. That is why they probably can die. And this is why it is so very important to immediately dissolve that clot from the brain. Otherwise, it will permanently damage that particular area in the brain where there is a blockage. And let me tell you, the strokes are of two types. One is ischemic stroke and second is hemorrhagic stroke. Now, what do you mean by ischemic stroke? Ischemic stroke is basically the blockage which is caused by the blood clot in the blood vessel of the brain. So it is just the blockage of the blood vessel in the brain. That is ischemic stroke. Okay. Now, what is hemorrhagic stroke? Hemorrhagic stroke is basically when the blood vessel is burst or it start leaking blood in the brain. Because of excessive pressure in the brain, that blood vessel can rupture, and once it is ruptured, there is a leakage of the blood in the brain. So both ischemic and hemorrhagic stroke are dangerous, and the patient needs to be admitted to the hospital on a very fast basis. The early you will take the patient to the hospital, the better chances of his recovery and rehabilitation is going to be there. Now, ischemic blockage is basically 8% in occurrence, whereas hemorrhagic is 13%. Now, what do you mean by 87 versus 13? 87 means out of 100 people, 87 people may have ischemic stroke, and out of 100 people, only 13 people will have hemorrhagic stroke. Now, in case of hemorrhagic stroke, if there is a bleeding which is to the tune of high amount, immediately the patient has to be operated. Otherwise, the patient may land into any kind of complication, including the vegetative stage or coma. Now, let me tell you what are the causes for ischemic stroke. The causes for ischemic stroke is specifically one. What is that? The fatty deposit line in the blood vessel. Any blood vessel which has got a fats deposited to it, which I told you, that is called as atherosclerotic plaque. If it is ruptured because of excessive blood pressure, specifically those patients who are hypertensive, they are not taking medications, or they are not serious about it, or even if they are ignorant about it, so that blood vessel can that clot, atherosclerotic plaque can actually rupture anytime, and that blood clot forms the fatty deposit that is called as thrombus. Now, once the thrombus is ruptured, it will start traveling to the different parts of the blood vessel. That moving thrombus is called as emboli. So what is thrombus and what is emboli? Thrombus is basically the clot, atherosclerotic plaque, when it is burst, that is thrombus. While this atherosclerotic plaque, blood clot, if it ruptures from that plaque and starts traveling, that is called as emboli. Okay, and it can actually stick into any blood vessel. Now, for the causes of hemorrhagic stroke, it is basically it happens in the weakened blood vessels, because usually weak blood vessels will start rupturing first. So you will have two types of hemorrhagic strokes. Aneurysm. Now, what is aneurysm? Ballooning of weakened spot of a blood vessel. The blood vessel starts ballooning. It will start oozing kind of stuff, and it will look like a balloon. Now, second is basically arteriovenous malformation. Now, what is AVMs? Arteriovenous malformation is basically the cluster of abnormal blood vessels in the brain that is the cause of hemorrhagic stroke. Now, let me tell you about the next terminology, which is called as transient ischemic attack, which is also called as TIA. Now, what is TIA? TIA is basically the warning strokes. It is a small prelude. It is basically, you go to a movie, what do you see? You see the trailer of that. So for stroke, this is the trailer. Transient ischemic attack is basically the initial stage which gives you warning that the patient may have stroke if it is not controlled. So that can happen before major stroke. Okay, so this transient ischemic attack can occur when the blood flow through a brain artery is briefly blocked or reduced. It is not completely blocked, but briefly blocked or reduced. Transient ischemic attack symptoms are basically temporary but similar to those of a full-fledged stroke. It is easy to manage. Transient ischemic attack is basically, I told you, it is prelude or a precursor, or basically the kind of the trailer for a person that he may land into stroke. So a person who has a transient ischemic attack is 10 times more likely to have stroke. I'm repeating, any person who will have transient ischemic attack is 10 times more likely to have stroke in his further life. Okay, so TIA is basically again a medical emergency, and the patient has to be rushed to this particular hospital. Yeah. Now, question is stroke preventable? Is it beatable? Is it treatable? Now, let me tell you that the good news is 80% of all strokes can be prevented with healthy behavior. That's the good news. Yeah. So long-term effect of a stroke may be minimized with immediate treatment, because I told you, the early you you reach to the hospital, the possibility for you or your patient to get better recovery is very high. So more people are surviving and beating stroke if they are rushed to the hospital on urgent basis. Now, when a stroke occurs and what do you do? Whenever in which conditions it actually occurs, and what you should be doing. So as a caregiver or as an individual, whenever you see a person with these kind of symptoms which I will tell you, you should actually follow a principle which is called as fast. Now what is fast? That is called as face drooping. I will show you how the face start drooping. If the patient start doing like this, so it is a kind of drooping. If the patient's face starts drooping, that's the first symptom of stroke. Okay. Second, fast may first F is face drooping, A is arm weakness. He will preferably have weakness in the arm, preferably left arm, but he can also have weakness in the right arm. Third, FAST, S, speech. He will start murmuring things. He will not be able to communicate to you properly. So he will start fumbling. So that is the third symptom. And the last one is it is the time for you to take immediate action. So I'm repeating: face drooping, first symptoms of stroke; arm weakness, second symptoms of stroke; speech difficulty, third symptom of stroke; and time to call and hit the hospital is the fourth thing which you should be doing immediately. So that is what is called as fast, and this is the best way to spot a person who is having a stroke. So whenever you see a person with drooping face, if he's talking to you and its face starts drooping immediately, or arm start weakening, or his speech is slurred, so in that case it is the high time for you to rush to the hospital. Now, this is how you should be spotting. Now, other stroke symptoms. What are the other symptoms apart from this face drooping, weakness, speech? So there will be a sudden numbness or weakness of the leg. I'm repeating, there will be a sudden numbness or weakness of the leg of the individual who is actually encountering stroke. Second, sudden confusion or trouble understanding anything. He will not be able to understand and he will be absolutely in confusion. So that is the second other symptom. Third, he will have sudden trouble seeing in one or both eyes. He will not be able to see things properly either from the one eye or from the both eyes. Fourth, other symptoms: sudden trouble walking. He may have dizziness and he may have loss of balance or coordination. So I'm repeating, he will have sudden trouble in walking, dizziness, loss of balance or coordination. And the last other symptom is sudden severe headache with no non cause. He can have extreme amount of headache. So let me summarize the other symptoms apart from the first one. First, I told you, face drooping, arm weakness, speech difficulty. This is the confirmatory test for stroke. What could be the other symptom? Sudden numbness or weakness in the leg, confusion or trouble understanding things, trouble seeing one or both from the both eyes, and trouble walking. He may have dizziness, loss of balance or coordination. Now, sudden severe headache is also one of the renowned cause for stroke. So in that case, you will have to immediately call the local emergency department and you will have to rush to that patient to the hospital. Now, why spotting a stroke is so important? Because spotting a stroke is so very important from the perspective of patient future life as well as the caregiver's life. Because if the patient is severely impacted with stroke, he may have to be bedridden for his full life. That is the agony the patient's caregiver will have to bear. That is the cost the caregivers have to bear. That is why spotting the stroke at early moment fast is so very important. So the sooner a stroke victim gets to the hospital, the sooner they will get life-saving treatment. So doctor understand what is the life-saving treatment. He will give immediately thrombolytic agents which will dissolve that clot. He will give blood thinning agent which will further decreases the density of the blood. He may go for operative stroke if it is hemorrhagic. If there is a leakage of the blood in the brain, he may have to immediately rush to the operative strategy. A clot busting drug called plasminogen. I'm repeating, tissue plasminogen activator. There is a drug which is called as TPA. It may improve the chances of getting better, but only if you get them help at the earliest. So there are other treatments also, but that is not something which I will be telling. I will just give you the summary of what are the other treatments. The other treatments are immediately the patient is taken care about the TIA or the stroke which he has. So immediate intervention, that is called as acute management, is done. And once the patient is stabilized, he will be sent back to the home, but with lifelong medications, which includes, I told you, blood thinning agent and antihypertensive drugs and your statins. Why statins? Because statin will decrease the chances of the further clot formation because of the accumulation of the fat in the body. So three drugs are going to be very much required, at least minimum three drugs. One antihypertensive, another is your blood thinning, and third one is your statin. So these are the three drugs which are so very important for a stroke patient, apart from the nootropics drugs. Now, what do you mean by nootropics? Nootropics are those drugs which are considered to be the supplements for the rejuvenation of the cells in the brain. Now, my question to, not question, but something which is called as, can we prevent a stroke? Everybody asks. Now, the good news is 80% of all strokes are preventable. I'm repeating, 80% of all kind of strokes are preventable. What is the strategy you should be opting? The strategy is reduce your stroke risk by controlling the blood pressure. Blood pressure is something which is so very a contributing factor for the stroke, because if there is a huge amount of pressure in your body, anytime that can lead to the rupture of the fat. I told you there is a fat which is accumulated inside the blood vessel. If there is a continuous pressure, that plaque can get rupture, and this thrombus, which transforms into emboli, can travel to upper, lower, any part of the body. If it is in the heart, it can travel to the heart and block heart muscles, that can lead to heart attack. And if it is going to the brain, it can cause brain attack, that is stroke. Or if it is going to the peripheral parts, it can cause PID, the peripheral disorders. Now, what is the first chances? If you reduce your high blood pressure 100%, there's a significant support to the possibility of not having stroke. Second, don't smoke much. In fact, don't smoke. That is, the smoking also triggers the chances of stroke. Then consume less amount of sodium. Why? Because sodium is something which is known to enhance the your blood pressure. Now, my question to you is, why sodium enhances the blood pressure? Because sodium is osmotic, it causes osmotic pressure, and it will always take away and carry water along with it. So when sodium is there in the body, it will always take water along with it, and that is why the blood volume of the person will increase. If the blood volume increases, your blood pressure will increase. If the blood pressure increases, the chances of stroke is going to be very high. So you will have to go for consumption of sodium to the less amount. Like, for example, you should take either zero sodium salt, or you should take less sodium salt. Yeah. Fourth point which can reduce the chances of stroke is, you will have to lower down your cholesterol level. If your cholesterol level is lowered down, the chances of that atherosclerotic plaque accumulation is going to be minimized. That is why I told you, why antihypertensive? Because antihypertensive drug is given, so the patient's blood pressure is controlled. Why? If the patient is told not to take the salty things or salt, he is told to curtail down the salt. Then he is told to lower the cholesterol, both from the dietary side, and he is also put on statin drugs, which will decrease the cholesterol. Then he is told and advised by the doctor to go for weight reduction. And when it comes to weight reduction, which means you are actually reducing the amount of fat which is accumulated in the adipose tissues. Where is the adipose tissue? In your stomach belly. So if you decrease your fats from your adipose tissue, the chances of further stroke is going to be minimized. So weight reduction is also one of the greatest strategies for reduction of the stroke. Then get physically active. So let me summarize once again why it is important. You can prevent your stroke by controlling your blood pressure, by curtailing down the smoking and alcohol, and consuming less amount of sodium, reducing your cholesterol, and losing your weight, and get physically active. And one of the most important thing which I would like to share with all of you is that stroke is not a one day process. It happens over a period of time, when your dietary habits, when you don't take care of your dietary habits, when you don't take care of your blood pressure, when you continue to smoke thinking nothing will happen to me. My dear friend, it may not happen one day, it may not happen in a month, it may not happen in a year, but gradually over a period of time, you are actually contributing in order to enhance the chances and probability of stroke. Moreover, Many people, they love to take a lot of salt, even additional salt in their diet. So salt is one of the poisonous substance in our kitchens, along with sugar and salt. These are the two poisons in our kitchen. If you reduce both sugar and salt in your diet, probably you will have lot of complications. You can actually avoid lot of complications which are related to the consumption of sugar and salt. For example, diabetes, for example, hypertension, for example, stroke. Then I told you to curtail your fatty substance, direct glucose, ice creams, fats, all these you will have to cut down. And let me tell you that when I say walking, it is proven scientifically, it is proven that if you walk or if you run, in between there is a walking which is called as brisk walking. Neither it is walking nor it is running, it is a fast walking, that is called as brisk walking. If you do 35 to 45 minutes of brisk walking every day, that too for minimum 5 to 6 days, the chances of stroke is going to be minimized by 15 to 20%. So walking is something which should be a part of your daily routine, and you should get physically active. And on top of that, what is most important is remaining happy in your life, because stress is something which is contributing factor for your enhanced blood pressure. So my dear friends, be happy, be healthy. Let me give you the summary of whatever I have told you. What is stroke? Stroke is basically a disorder of the brain wherein blood vessel in the brain get blocked because of any blood clot which is there, which goes and travels to the brain. Now from where this blood clot came? This blood clot came from the blood vessel. It could be any blood vessel in the body where there is a atherosclerotic plaque. Now what is this atherosclerotic plaque? Atherosclerotic plaque is basically the calcification of unnecessary fat along with the calcium over a period of time, which means in simple language, it is basically a fat which is deposited in the blood vessel. Lumen means the cavity of the blood vessel. And over a period of time, because of uncontrolled hypertension and your sedentary life and dietary habits, this uh, plaque which is already there can rupture. And if it rupture, it goes to the brain. If it goes to the brain, it can break that blood vessel in the brain, that is called as hemorrhagic stroke. And it is, if it is stuck to the blood vessel and blocks it, that is called as ischemic stroke. Ischemic stroke happens to the tune of 87%, whereas your hemorrhagic stroke happens to the tune of 13%. Stroke is basically the fourth leading cause of death, and 30% of all people, they cannot accurately identify. So identification of stroke is very, very important. Why and what are the symptoms? I told you, you can immediately see to the person. Always remember four things. Fast, FAST. Fast is face drooping like this. A is arm weakness, weakness in the arms. S means slurring of the speech. The person will start fumbling. So this is how you can actually. And T is your time to call to the doctor. Immediately rush. And what are the other symptoms? Other symptoms are numbness and weakness of the leg, sudden confusion, trouble understanding things, trouble seeing from one or more both the eyes, and trouble walking, dizziness, loss of coordination, sudden headache. These are the other symptoms. So in that case, you will have to go for emergency. Once the patient is treated, he is back to the normal life, then you can actually control the blood pressure of the patient to avoid further chances of stroke. Quit smoking, quit drinking, consume less amount of sodium, lower down your cholesterol level, go for exercise, regular exercise, go for physical activities, and come out of the sedentary life. I hope that this small session on the stroke is going to help you understanding and taking care of a person who is actually landing into stroke. So thank you very much. Have a wonderful day ahead. Such kind of small medical sessions I will continue to take in future as well. So please help me establishing my channel by liking it and forwarding my videos. Thank you very much.